One type of insurance I could choose without being required by law to do so is health insurance. It is the primary insurance in the US, where public healthcare is universal and free. However, in my country, Spain, the state covers basic sanitary necessities through civil taxes, but even then, the access to public healthcare in Spain is slow and tricky. And wait queues are prolonged, and because of that, having private health insurance allows you easier access to medical centers, and in some cases, you get to choose them. It covers the cost of hospital bills and medication for annual or monthly fees to the insurance, covering costs you could usually not afford depending on the difficulty of the operation or if you had prolonged stays in the hospital, which is expensive. Health insurance could have its cost raised or lowered due to tobacco use, family history, age, dangerous lifestyles, or occupations. These companies use risk factors to determine how much a person is at risk of going to the hospital, whether that person will go multiple times, whether that person has to constantly buy medication, etc., to place a price on the insurance that will ensure that the company doesn't lose money every month or year covering that particular person's costs. For an example, when you might need to use health insurance, a few years ago, I had surgery to remove a potentially dangerous mole I had in my left arm for analysis. The public healthcare system didn't want to remove it as they deemed it not dangerous, but I still wanted to remove it. And the reason I was able to do so was thanks to my private health insurance allowed me to have my surgery, and everything went well. The mole was benign. It is a genuinely helpful money sink, and if you start early with your health insurance, the price will be low at first and will usually stay that way as time passes, making things cheaper for you in the long run, though not in the short run. They are handy, and I recommend getting one once you have the financial stability needed to afford one. But in Spain, my home country, private health insurance isn't indispensable, as the populace has access to free public health insurance. The system's main drawback is the long wait time between surgery dates. And circumventing these long wait times is one of the reasons why people procure private health insurances despite the additional spending. That is why I believe that health insurance is necessary even in countries with free public healthcare.